The wet to dry dressing is used occasionally for large open wounds, the result of infections or evisceration. For stage 4 pressure ulcers, the current treatment plan is occlusive foam dressing. Prior to starting, explain the procedure to the client to allay fears and ensure cooperation. Be honest about any discomfort that might be involved. The client should be offered pain medication early enough for the medication to take effect before starting the dressing change. Additionally, note the client's allergies, especially to adhesive tape, povidone iodine, or other topical solutions or medications. The items needed for the procedure are absorbent gauze pads or a gauze roll, sterile saline or ordered liquid, sterile basin, large protective gauze, sterile gloves, binder, or straps to hold the gauze in place. Often this dressing is used for an open wound, which is not easy for some clients to look at. Offer to let the client see the wound, perhaps with a mirror, or shield the wound from view if the client requests this. Wash hands thoroughly before beginning the dressing change using soap and water or alcohol-based rub. To remove the dressing, put on non-sterile gloves. Depending on the depth of the wound and the wound site, additional protective personal equipment may be needed, such as goggles, gown, and possibly a mask. At one time, the practice was to remove the dry dressings in order to pull away dying tissue. We now know that this also tears away new tissue growth. To avoid damaging new tissue and putting stress on a healing wound or incision, the dressing should be moistened so that it can be gently pulled from the wound. Loosen the soiled dressing by holding the client's skin and pulling the tape or dressing toward the wound. Moisten the tape lightly with acetone-free adhesive remover in order to make the tape removal less sensitive, particularly if the site has a lot of hair. Once the dressing has been removed, observe the wound for drainage, swelling, color, pockets, odor, and hopefully evidence of healing. Healing will be noted in redder tissue with pinpoint bleeding. If a surgical drain is present, note the condition of the site and document the assessment findings. Be careful not to dislodge the drain during the procedure. Use gauze that has been pre-moistened with saline to cleanse around the wound site. Cotton balls tend to shed fibers and can lead to irritation, infection, or adhesion in the wound. Discard the old dressing and the cleansing gauze into an appropriate waste container. Remove gloves and wash hands. Set up the dressing supplies using sterile technique. Set out the sterile basin and pour in the sterile saline or ordered soaking solution. Drop the gauze into the sterile liquid. Drop the sterile protective gauze onto the field. Open and put on the sterile gloves. Squeeze the gauze gently so that it remains wet but it's not dripping. Always wipe the site from a clean area to a less clean area, often top to bottom because more wound exudates collect at the bottom of a wound. If the client has a surgical drain, clean the drain's surface last because it tends to collect exudates and promotes bacterial growth. This area is considered the most contaminated. Use each gauze pad or swab for only one stroke to avoid tracking wound exudates and bacteria from the surrounding skin to the clean areas. When using gauze pads, lay each pad into the wound, packing it gently against the tissue. If using the gauze roll, then unroll and fan fold the gauze into the wound. A dressing with an absorbent side is placed next to the gauze. The dry side faces the outside like skin. The dressing is held in place with an elastic binder, Montgomery straps, gauze wrap, or a loose elastic bandage. It is often difficult to tape the dressing place. Prior to adhering tape to the skin, cleanse it and dry thoroughly using a sterile 4x4 gauze pad. Then remove gloves and wash hands. As with all dressings, label the site with the date and time of the dressing change. Be sure to document the client's response to the dressing change, the observation of the wound, and the type of dressing change performed.